My name is Emma Reed. This presentation is regarding Shigella species pluralis, which is the bacteria that causes shigellosis. Shigella bacteria evolved from E. coli ancestors approximately 35 to 270,000 years ago and was first discovered by Japanese scientist Kiyoshi Shiga in 1896, but did not become an official genus until the 1950s. Shigella belongs to a group of pathogenic organisms that includes Cryptosporidium and is, of course, phylogenetically related to E. coli. There are 4 different species: Shigella sone, Shigella flexneri, Shigella boydii, and Shigella dysenteriae. These species have 54 different serotypes, approximately. Serotypes are the distinguishable strains of any microorganism. Shigella is a gram-negative facultative bacilli. It is an anaerobic, non-spore-forming pathogen that is generally non-motile. Although Shigella does possess flagellar genes for motility and chemotaxis, still, the vast majority are non-motile. Nutritional requirements include iron and pyruvate. Pyruvate is necessary for intracellular growth, and the iron is used in several intracellular processes, such as DNA replication and respiration. Shigella reproduces through conjugation, which means that it completely transfers its genetic material through the use of a pilus. Humans are the definitive host for this bacteria. It exists all over the world, but it is more prevalent in developing countries. The World Health Organization estimates that shigellosis causes 160 million cases of diarrhea each year, as well as 1.1 million deaths. It is thought that in developing countries, the seroprevalence of Shigella may be 20 times higher than in first world countries. The bacteria is spread by ingesting contaminated materials. Most commonly, this will happen when an area floods and sewers are compromised. Areas are most at risk during the rainy season. Shigellosis is one of the major factors worldwide contributing to the morbidity of children under 5 years of age. Up to 61% of deaths under age 5 can be attributed to Shigella. People who are immunocompromised, as well as the elderly, are at a higher risk of complications from shigellosis. Shigella, shown on this graph in blue, shows the breakdown of those who succumb to shigellosis by age. As you can see, there is a significant spike of infections in early childhood. The red line on the graph is Shigella's close cousin, E. coli. This world map shows the general trends for shigellosis infections. Red and orange comprise the most affected countries, and the blue-green color indicates least affected. The trends of developing and developed countries are apparent here. Upon Shigella's invasion of the mucosa through the M cells, there is an inflammatory response by the host that benefits the bacteria. Tight junctions of the colonic epithelium are interrupted, allowing the Shigellae to enter the submucosa. As the cells are taken over and die, the inflammatory response causes leakage of blood and mucus into the intestinal lumen, which explains the bloody mucus in the feces. For some people, Shigella passes right through their digestive tract, but their bodily processes can still, unwittingly, facilitate in disseminating the bacteria to others. Shigellosis can be very serious. For example, Shigella dysenteriae can lead to hemolytic uremic syndrome, or HUS. Without treatment for HUS, patients will have low platelet counts due to hemolytic anemia, and they can go into shock, suffer renal failure, and cardiac arrest. The first step in the diagnosis of shigellosis is for the provider to evaluate the patient's symptoms. Then, a sample of the patient's stool is sent to the laboratory to identify the offending bacteria. This task is difficult to do, as Shigella looks a lot like bacteria that are normally found in the colon flora. Shigella also bears a remarkable resemblance to E. coli due to its phylogenetic relationship. It is imperative that the correct species is identified so that the patient can receive the appropriate treatment. Treatments that are used most commonly would be antibiotics. Ciprofloxacin is prescribed for adults, and azithromycin is prescribed as the optimal treatment for shigellosis in children. Ciprofloxacin inhibits DNA replication, and azithromycin interferes with protein synthesis by inhibiting translation of messenger RNA. Antibiotics can reduce the duration of the illness, as well as reducing the duration of fecal shedding of the bacteria. Shigella exhibits horizontal gene transfer, as is shown in the fact that the bacteria is becoming increasingly resistant to antibiotics. Basic hygiene, hand washing, and disinfection of surfaces goes a long ways towards controlling the spread of this bacteria. There are many studies being done to try and mitigate the effects of Shigella, many of them promising, but at this time there is no cure in the foreseeable future.